Hello, my name is Aidit Mikael bin Nazib, and our group will present on safety and health management in government agencies. First of all, human resource management in the public sector protects the health and safety of over 1.6 million civil servants in Malaysia. These employees work in various places, ranging from standard offices to dangerous disaster zones and healthcare facilities. Occupational safety and health is essential to identify and control workplace dangers. While older safety rules mainly focus on factories and building sites, the Occupational Safety and Health Act 1994 made this protection necessary for government agencies too. A new law update, Act A1648, started on 1st June 2024 to bring stricter safety checks, require safety coordinators, and introduce heavy fines for agencies that ignore the rules.
Assalamualaikum to Madam Sekaliana. Today, I will talk about the purpose of safety and health management in government agency. The main goal is to protect government workers from dangers and illnesses. It helps different departments work together to follow national laws and build a shared culture of safety. Now, let's look at this main point. The first one is protect civil servants. It sets up a strong system to prevent workplace accident and injuries. This is this is important because civil servants work in many different places from office to high risk area. Keeping them safe ensure that public service runs smoothly every day. After that, it helps nation follow national law. It gives department clear official processes to meet safety rule and avoid penalties. This mean government agency must follow strict rules like the Occupational Safety and Health Act. This framework help department easily stay compliant and so they do not face heavy fine or legal trouble. And the last one is encourage continuous improvement. It push agencies to regularly check their offices, test for risk, and update their safety rules. This means workplace danger can change over time. This point means agency must constantly check for new hazards and update their safety plan before accident happen.
Assalamualaikum warahmatullahi wabarakatuh. My name is Syed Ahmad Muzafar bin Abdul Muiz. My metric number is 2025 809 558. So today I would like to present my part 3.1 is invent injuries and hazard. So first is the challenge and core imperative. Government agency must implement robust safety system to protect civil servants from serious workplace accidents that reduce productivity and raise societal healthcare costs. Number two is legal responsibilities and risk frameworks. Under the Occupational Safety and Health Act 1994, public sector employees are legally obligated to use structured risk systems like HIREX to identify and manage hazards, especially in older facilities. Number three is high risk frontline operations. Frontline emergency workers such as firefighter require training in a quick risk perceptions, fast hazard identifications, and real-time communications to minimize injuries in highly unpredictable environments. Number four is office workers and ergonomics. Office workers face hidden ergonomic risks uh, from prolonged desk work, which must be addressed. Use priority engineering and administrative controls rather than temporary personal protective equipment. Senior management, number five is human behavior and management commitment. Senior management must actively counter unsafe human behavior by establishing dedicated safety committees strategies that proven by the REACH program 70% reductions workplace accidents. So the last one is psychosocial safety climate. Fostering a supportive psychosocial safety climate through open communications protects employees' morale, reduce staff turnover, and ultimately optimize overall government's productivity. So I think that's all from me, and thank you.
Hello, madam. Here I will talk about the importance of occupational safety and health management in boosting performance and productivity. Firstly, reduce workplace accident. Accidents happen when workers are not careful or lack training. Safety rules, awareness programs, and protective equipment help reduce injuries. When workers feel safe, they can focus better and work more productively. Secondly, strong safety laws in Malaysia. Malaysia started with the Perak Boiler Enactment in 1890 and later introduced the Occupational Safety and Health Act in 1994. This law makes industry responsible for safety while agencies like Department of Occupational Safety and Health and National Institute of Occupational Safety and Health monitor them. This reduces risk, especially in dangerous jobs like construction. Thirdly, worker participation. Employees should join safety committees and report hazards. When workers are involved, they feel responsible and follow rules better. This teamwork builds a strong safety culture and reduces accidents. Fourth, mental health and well-being. Safety is not only physical. Stress, burnout, and poor workplace design can harm workers. Programs for stress management and ergonomic furniture help workers stay healthy, reduce sick days, and improve morale. Furthermore, emergency preparedness. Workplace must be ready for emergency like fire or chemical spills. Clear plans and training help workers act quickly and safely. This reduces harms and keeps the workplace running smoothly. Lastly, support national growth. Safe workplace improve productivity, reduce risk, live, and attract investors. They also build public trust. By making safety part of everyday work, Malaysia can grow in its economy while protecting workers.
Next, I would like to talk about the importance of safety and health management in government agencies, which is reducing organizational costs. First is efficient budget management. Since public administration utilize taxpayer resources, effective safety management ensure public funds are used efficiently by minimizing unnecessary expenditures. Furthermore, workplace prevention initiatives are economically advantageous and yield a strong return investment. Next, reduction of direct costs. Structured safety programs lower the direct expenses associated with workplace injuries, including hospital stays, medical care, and rehabilitation. Lessening workplace hazard helps prevent the depletion of an agency's financial resources from sick leave and legal fees. Apart from that, minimization of indirect costs. Proper safety management decrease indirect expenses such as lost work hours, diminished productivity, and damage to valuable public property like specialized equipment and emergency vehicles. It also prevents operational disruption caused by post-accident safety assessment and investigation. On top of that, mitigation of hidden costs. Safe workplace reduce absenteeism and staff shortages caused by extended medical leave, which otherwise diminish overall team output. Implementing preventive measures helps agencies avoid elevated overtime costs incurred when staff must take on additional responsibilities. Moreover, avoidance of penalties and legal fees. Establishing a strong safety culture ensures compliance with national safety regulation, avoiding financially burdened penalties. It protects ministries from incurring major legal fees, facing protracted litigation, and paying potential settlements resulting from negligence. Lastly, long-term financial strategy. Recognizing occupational safety as a long-term investment rather than a short-term expenses yields measurable financial returns. The financial savings generated from reduced medical and repair expenses can ultimately be redirected toward community programs.
Now, moving on to our next slide, establishing safety committees and strict occupational safety and health policies. First, establishing strict safety policies and active safety committees is essential to protect workers and reduce workplace accident. This means we cannot just hope people stay safe. We need formal committees to look after everyone and make sure accidents do not happen in the first place. Second, they measure this measure provide clear, written rules that ensure daily safety laws are consistently followed instead of ignored for short-term gain. This means having things written down make the expectation clear. It stops people from taking dangerous shortcut just to finish a job faster. Lastly, they also create a vital bridge between management and employees, allowing everyone to work together to find and fix workplace dangers before they cause serious harm. In short, safety is teamwork. When bosses and workers talk to each other openly, they can fix broken equipment or hidden danger before anyone get hurt. Thank you.
Next, I'm Muhammad Hanifaikal bin Abdul Hashim. Will be talking about my part, which is continuous training and fostering a preventive culture. We have continuous and role-specific training. Training must be an ongoing process to keep safety protocols fresh and update staff on shifting legal standards. It is a tailored program that should focus on specific risks of different role. For example, administrative staff should focus on ergonomics and proper workstation so they prevent strain when prolonged sitting or standing, while a frontline personnel should focus on intense situational training to boost real-time hazard identification and tactical communication. Moreover, we also have building a preventive culture. It could it could bring risk reduction that shift the focus toward actively reducing both work-related and non-work-related risks across all departments. We must share responsibility that align with national frameworks to make safety a natural part of daily operation rather than a separate chore. Next, on continuous training and fostering a preventive culture, we have leadership commitment and recognition, which also play a massive part. Leader must drop the ego, listen to feedback, and build trust by consistently acting on reported safety concerns. Leaders must also publicly recognize or reward employees who bring up safety issues to encourage a highly proactive team culture. While a communicative, open communication environment eliminates the fear of blame or administrative penalties, so civil servants feel safe reporting minor hazards that can cause harm in the workforce.
To summarize, safety and health management in government agency is not just about following rules. It is about protecting employees, improving performance, and saving resources. By working together through policies, training, and communication, agencies can build safer workplaces that boost morale, reduce risk, and strengthen public trust. Safe workplace means stronger organizations and a healthier nation.